Hello, my well-being buddies. Welcome back to this session. And it's all about creating a safe space. And it's an EMDR skill for eye movement desensitization and reprogramming. And it's a technique used in trauma therapy. But I've used it in primary healthcare now for the last 6 months. And I have to say, it was well received and it works really well. And it works well for anyone. So if you're feeling anxious, if you're feeling stressed, if you're feeling you just can't cope, instilling this safe space into you is a great way to do it. And we're going to try and do it remotely today. And this is a disclaimer. EMDR is a skill that you should be doing with a licensed therapist. It is something that you should be doing on a one-to-one. However, the evidence does say that there's very little harm in doing this as an activity for you to try to see how you get on with it, and just to see how you cope. So it is the first thing that most EMDR therapists will do, which is instilling the safe space. So there's a couple of steps to this. One is to identify it, then we visualize it, we think about it, and we hold some of the words in our mind, and then we process. And we process by me doing this. Now, you'd have seen me doing this in other videos, and it's now become a bit of a habit because I'm doing my EMDR therapy training. So all of the time, my hands just naturally seem to be going up in the bilateral stimulation movement. And what that basically means is, as we're focusing, our eyes are moving left to right. And as our eyes move from left to right, it does a process called REM, the rapid eye movement. And it's what we do at night. So when we sleep, our eyes go back and forward. And if you do light hypnosis, you can see the eyes flickering. And that's processing information into the computer bank up here, and it's moving it around and reprogramming and restoring. So that's how it works. Now, if you have a problem with following, you can do the butterfly tap. So again, if you find doing that as a distraction, don't worry about it. Just close your eyes and tap. And what it does is it's using the left and right side of the brain to create this space to store things. So we'll give this a go. Okay, so what I want you to do is make sure that you're sitting in a comfortable room, you're nice and quiet, no one's going to distract you for the next few minutes, just while we think about creating a safe space. So what I want you to do is I want you to think about a place where you feel the safest, the most comfortable. It's got to be peaceful and it has to be calm. Now, I want you to avoid images containing family members or people because they both have positive and negative associations. So this is about you finding a place. Now, for me, for example, it might be, I love the seaside. I love staring out at the sea because I can't see anyone, just the waves. So that's kind of what we want you to think. Okay, so just want you to hold that. I want you to think about that. Okay, great. Thinking about that safe, comfortable place, which is secure, and it makes you feel calm and safe. Have you got it? Great. So what I want you to do now is I want you to hold that image and bring it up into your mind's eye. Now, if you're not very good at visualizing, try closing your eyes and just visualize that safe space. So for example, for me, standing out looking at the sea, but for wherever yours are, just visualize that safe space. Now, what I want you to do is, now we've got the image in our mind, I want us to enhance that. So I want you to now just tell me, this is going to be a bit weird, just imagine we're here, we're on a one-to-one. Describe to me the sounds that you can hear. Can you hear anything? Go to your safe space. What can you hear? Good. Good, just notice that. Now, are there any smells that you can smell? Good. And are there any other sensations that you notice when you go to this safe space? Good. So what we've now got is a very clear image in our mind's eye. We've got that clear image of our safe space. We understand what it is we're doing. We know where we're going to go. And I can trigger it with some sounds so I can hear those waves and I can smell that sea and fresh air. Great. Now, I want you to focus on the image again. And now just let me know how it feels. Is it positive? And do you identify the location with a pleasing physical sensation? So just tell me now, what do you notice? What do you feel? Good. So this needs to be a positive place. If it's not a positive place, if it's not bringing up that feeling of calm, relaxed and joy, it's not the right place. Go back and start again. Okay. Now what I want us to do is this. Actually, we'll go this way. So what I want us to do is this. I want you to follow my fingers. I want you to keep your head nice and still, firm. We're going to just be using our eyes. Like that. It's very difficult for me to do. So follow these fingers nice and slow. Okay, we'll stop there. Have you noticed any pain? Is there any discomfort? If there isn't, good. Let's carry on. If there is, I want you to go to tapping. Okay, so let's just go this nice and slow again. Okay, are we happy with that? Grand. So now what we've got the image, we've got that enhancement, the sounds, the smell, and the feeling of joy and calmness. So here we go. Nice and calm. Are we ready? I want you to bring that image up of where you feel safe and peaceful and calm. I want you to think about the pleasant sensations on your body and allow yourself to enjoy them. And as you notice those sounds, follow my fingers with your eyes. So here we go. So bringing that image up, notice how it feels. Is it calm and peaceful? Notice how you feel with that sensation. Follow my fingers, that's good, well done. What do you notice? And how do you feel? Hopefully you're feeling a bit calmer and a bit more relaxed. Again, if you struggle, let's do this. So we'll do that one more time. So I want you to bring up that image of your safe space. I want you to think about those positive feelings, and I want you to focus on that location and about those pleasing sensations. Ready? And if you can't follow my finger, just tap. So bringing those images up now. Think about that safe space. Think how it makes you feel. Think about your body. Good. Wonderful. Notice, just notice. And back. So, how do you feel? Hopefully, you're feeling relaxed and safe. Now, what I want us to do is I want us to think of a cue word. So this cue word is about now bringing this image to your forefront and making you feel safe when you need to use it. So for example, this could be relax, safe, in control. But as we do this now, I want you to repeat that in your mind's eye as we go through this, okay? So I want you to remember your cue word. Hopefully you've got it. Shout it out to me now. Good. Hold that thought. we're going to go with it. Okay, so I want you to bring up that image. Think about that safe space, how calming it is. Notice those other things around you and bring in that cue word. Good. Just notice and repeat that cue word. Keep repeating that cue word associated with that image. Good. Just notice. Good. Breathe in, deep breath, and out. Now, we're going to repeat that again. And we're going to get you to bring up the image, bring up the cue word, and we're going to put that cue word with those images. So again, bring your cue word to the front of your mind, bring that image up, and now let's bring the two together. Ready? Thinking about that safe space, wherever it may be, enjoying it, feeling safe, and linking that cue word. Good. Take a deep breath in and out. Now, hopefully, there's no negative feelings. If there are negative feelings, then we need to change the cue word. So go back to where we was asking you about the cue word and repeat that again. And repeat it until you've got the right cue word in. Now, what I want you to do now, I want you to think of a minor annoying thing that's probably happened to you. And notice how that is. So for example, let's say you've got a parking ticket and that makes you feel pretty annoyed, pretty angry. I just want you to think about how you feel right now thinking about that. Are you feeling annoyed? Does it make you feel a bit angry? Okay, good. So we'll stop there. What I now want you to think about is your cue word. So whatever your cue word was, say it out loud now. And notice that cue word. Has that cue word brought you down a bit? Is it making you feel calmer? Is it making you feel more relaxed? Good. So now what I want you to do is I want you to take a deep breath in and out. In and out. Now, if you feel calmer, great. If you don't, we're going to go back to some of this and we're just going to reinforce it. So again, just follow my fingers. Think about your safe space. Think about how calm you are, how relaxed you are. Just notice that. And again, think about your cue word. Good. Take a deep breath in. What do you notice? And just do that again. Bring up that minor concern. Think of the cue word. And has that calmed you down a bit? Good. If it hasn't, just repeat that back. But if it has, now let's move on. So what I now want you to do is bring up a different minor disturbance or concern. And I want you to now use the positive images that you had and the cue word at the same time. And let's see what happens. So again, bring up some minor annoying. Think of your safe space. Think of that cue word. Deep breath in and out. And notice how you feel. Can you feel that you're calming down? If not, let's repeat the cycle. So again, thinking about your place of safety, thinking about the cue word, and let's reinstill it one more time. And again, if that hasn't worked, do your tapping. Hopefully then what's happened now is if you go back to that minor disturbance, you can think about it, you can tap, or you can follow my fingers, and that should have left you nice and calm. But by just bringing up now that image and those thoughts, hopefully that's put you into a safe space. So that's how safe space works in EMDR therapy. Ultimately, there's lots of different techniques out there. And obviously, this forms part of a trauma-focused therapy group, but EMDR can be used for lots of other things as well. So if you think, actually, I quite like EMDR, I like the way that it works, I like the fact that it brings things forward into the working memory and reprocessing, then ultimately you can email me and I can obviously give you more advice and guidance on how to get some therapy sessions. And I have to say, I have used it. I've used it in bereavement. I've used it in emotional several personalities, and I've used it in anxiety. And it does work across the board. It is a great tool just for slowing your mind down and making you feel nice and calm. Hopefully you enjoyed that EMDR session, and I will see you in other videos. Take care. Bye for now.